Welcome to this week's edition of Public Health Updates, covering the latest breakthroughs. Brought to you by LucidQuest. A sweeping population-based study analyzing over 56 million pregnancies has found that children born to mothers with diabetes face a 28% higher risk of developing attention deficit hyperactivity disorder, autism spectrum disorder, or intellectual disability. The risk is particularly elevated in cases of pre-existing type 1 and type 2 diabetes compared to gestational diabetes. Notably, both the duration and severity of gestational diabetes further amplify this risk. Researchers emphasize the importance of early diabetes screening and proactive treatment in women of childbearing age, as maternal glycemic health is now recognized as a pivotal factor in childhood neurodevelopment. In a groundbreaking study on long-term memory, researchers discovered that just one night of quality sleep can improve memory for real-life event sequences for up to 15 months. However, no significant effect was observed on the recall of visual details such as shape or color. The improvement was linked to specific patterns of brain activity during deep sleep, particularly slow-wave oscillations and sleep spindles. These findings underscore sleep's active role in memory consolidation and suggest that targeted sleep interventions could support cognitive resilience well beyond the short term. New evidence suggests that GLP-1 receptor agonists like Ozempic and Wegovy may reduce the risk of dementia in individuals with type 2 diabetes. Researchers propose that the protective benefits extend beyond blood glucose control, potentially due to reduced systemic inflammation and improved cardiovascular health. While these findings support a growing body of research on the cognitive advantages of GLP-1 drugs, experts caution that targeted clinical trials are still needed. The results may influence future prescribing decisions, especially for diabetic patients at elevated risk for cognitive decline. Emerging research reveals that clusters of common food additives, rather than individual ingredients, may significantly elevate the risk of type 2 diabetes. Two specific mixtures containing emulsifiers and artificial sweeteners were associated with increased diabetes incidence, even after adjusting for lifestyle factors. These findings challenge existing food safety assessments, which typically evaluate additives in isolation. Scientists are now calling for a re-evaluation of regulatory approaches that account for the synergistic effects of additive combinations commonly found in ultra-processed foods. A recent preclinical study in mice demonstrates the critical importance of vitamin K, particularly the MK4 subtype, for brain health. Mice fed a vitamin K-deficient diet exhibited impaired memory, reduced neurogenesis, and heightened brain inflammation. The decline in MK4 levels was especially pronounced in male mice, who also showed decreased survival rates and stunted weight gain. This study expands our understanding of vitamin K's role beyond blood clotting, highlighting its emerging relevance in aging, memory, and neurological function. Stay ahead in public health research. Like, share, and subscribe for weekly updates. Visit www.lqventures.com or email us at info@lqventures.com for expert healthcare consulting. See you next time.